In a world where sight is the gateway to life's wonders, imagine a world plunged into darkness. Join us on an extraordinary journey into the heart of an elephant's struggle for vision, where the bonds of compassion and the miracle of modern science unite to restore not just sight, but hope itself. Cataracts are a common occurrence in elephants. Ocular disorders in elephants are the result of a history of trauma, extreme malnutrition, disease, or age-related conditions.
Vantara is obviously one of the guardians of the species in India, and obviously having all this pioneer work and trying always to break barriers in terms of animal welfare.
My name is Dr. Yaduraj and I am a head veterinarian at the Radhakrishna Temple Elephant Welfare Trust. Tarzan is a very young male elephant that we have. He is about 14 years old, is very energetic, but unfortunately he had a cataract in his left eye and he was not able to see from that eye at all.
The animal doesn't understand what is going on. Sometimes can actually react to a shadow, and it can be aggressive towards that shadow.
Being a young elephant, he had all his life ahead of him, so we contacted the veterinary ophthalmologist team in India.
I'm Dr. Kasturi Bharsavre. I am the founder of the iVet clinics. If you leave these cataractous lenses in these elephants, then certainly they are going to form further complications. At some point they are going to fall off, and when they fall off they are going to create a lot of pain, discomfort, and at that point doing a cataract surgery will not be an option.
Get this lens that is specifically required for elephants, and we found out that there was a company in Germany that makes the lenses for animals specifically, and one of the team members who carried out the surgery, Dr. Richard.
I'm Professor Richard McMillan from Auburn University, located in Auburn, Alabama. The importance of doing cataract surgery in the elephant is it going to, first of all, improve vision, 2, improve the health of the eye, and 3, improve the quality of life for the animal.
Professor Richard, Dr. Kasturi, and our team of RKTEWT's resident vets took a deep dive into the complications of the process.
If a cataract develops slowly, that can be a gradual change and they can get used to that a little bit better. But for cataracts that have a quick onset, that can be quite detrimental to the animal or confusing for them when it occurs.
Trauma is definitely one of the causes, because these are all rescued elephants. They have come from all over India, so we don't know, whether there was a hit in the eye, or we've seen a lot of corneal erosions, corneal ulcers as well.
So with the decreased vision, they can't see things that they otherwise would be able to see. From a medical standpoint and an overall health standpoint of the eye, the earlier we can remove the cataracts, the better it is for the overall health of the eye.
In terms of preparing for the cataract surgery in an elephant, we initially started with pre-op examinations, which we performed about 2 months ago. Once all that was done, we performed the ultrasound and we did a thorough internal exam of the eye, and that's how we selected him.
The team had major concerns over carrying out surgery on such a large animal. The elephant needed to be sedated for a zero-risk situation. This couldn't have been possible without the support of anesthesia specialists Dr. Nikorn, Vanlaya and Umaporn.
We use medetomidine with ethofine. We have to mark the area that we inject the ethofine to aware the people to work around the animal.
We're gonna inject by intramuscular deeply, and you see the animal can be down and deep to the state appropriate for the surgery.
As soon as the elephant was anesthetized, we quickly wheeled everything in and we got in our positions, and we knew exactly where to sit because of the dry rub. The cataract surgery can only be done when it has to be right. The lens needs to be in normal position, the eye needs to be quiet, it shouldn't be really inflamed.
We injected 10 milliliters of lidocaine in 4 different spots, which essentially gives us 40 milliliters of fluid, local anesthetic behind the eye, in order to immobilize the globe, and it also helps to position the globe a little bit towards the eyelids. It raises the eye up a little bit.
The operation was meticulous and lasted for hours. The surgery was a success, marking the first of its kind anesthesia infusion in India.
No, amazing. Very smooth, fantastic.
Thanks to the dedication and passion of this team, this project has shown a new dawn to Tarzan to explore objects, shapes, and the infinite shades of green here at Vantara.